Hello, dear friends. I want to share some information about breast enlargement surgery with you today. As our patient sits here, we perform breast augmentation for women wanting larger breasts, especially if they have lost volume. For breast enlargement, we place breast implants. We can use breast implants to enlarge the breasts, or we can use your own fat tissue. I will explain fat tissue augmentation in another session, another broadcast or video. Let's focus on breast augmentation using breast implants today. Currently, there are several brands of implants used in Turkey, all of which are high quality. There are also various types of implants. Implants come in two types, saline and silicone gel. In Turkey, we primarily use implants filled with silicone gel. Nearly all brands now produce cohesive, non-flowable implants. I will first provide some terminology, then we will discuss the surgery, dear friends. In these implants, there are also those with a non-flowable character and a textured outer surface. Some are flat on the outside. Some have a bumpy outer surface as well. They fall into macro or micro rough categories. They belong to different types. Among these, there are also various types of prostheses, including round and teardrop shapes. Recently, prostheses filled to 100% have been manufactured, along with those filled to 80%. In other words, there are really many different classifications and content models. Now, which one will we use from these? The most important criterion here, dear friends, is your examination findings. We will start by examining you. What is the issue? What isn't? We will check those. After identifying this, we will listen to you. What is your request? Sometimes a patient comes to us and explains their wishes. Some requests may not be feasible surgically. This could be the case. It can happen like this. Sometimes someone has had breast augmentation surgery multiple times. However, later I will mention the possibility of a condition we call capsular contracture, which is an exaggerated reaction of the body to the prosthesis. That patient requires a different type of prosthesis. However, what happens? Please know this clearly. All the prosthetic brands currently in routine use in Turkey are indeed very high-quality brands. Some are produced in Germany, while others are of American origin. Some are produced in France. However, there are indeed quite high-quality prosthetic brands available. I can tell you that the brand I use and all the others used in Turkey are of excellent quality. Now, you came to us, we checked you, and we picked the prosthesis type. Then we will proceed to the surgery stage. Before moving to the surgery stage, dear friends, we inform you about the surgery during your examination. For example, what do we consider? Now, where can we place the prosthesis? We can place it under the muscle. We can also put it under the fascia or under the breast tissue. That means we have three different plans. We can place the breast prosthesis in three different locations. We decide on these placement locations according to your examination results. For example, let's say we decided to place it above the muscle, but the tissue is very thin. What do we do then? We can talk about some technical details, such as enhancing the décolletage area with a bit of fat injection. In addition, there are various locations where we can place the prosthesis, my dear friends. It cannot be placed from a single point. We can place the prosthesis from under the breast fold. It's one of the best hidden spots. We can place the prosthesis from the armpit. It's one of the best hidden areas. We can place the prosthesis around the colored area of the nipple. The prosthesis can be placed where the colored area meets the normal skin, which is also a good hiding place. There's the belly button method, which is less common and a bit idealistic, but this is really a bit more utopian, and it's a difficult method in terms of surgical technique. I wanted you to know this for your general culture. Now, the prosthesis path. We have selected the pathway for placing the prosthesis. What do I usually use? For instance, if you had come to me 10 years ago, I would have said, let's use the prosthesis filled with serum from the armpit. Honestly, I still believe that this is the healthiest prosthetic model, but since our Turkish people describe the serum inside the breast like water, I will say it that way. I just hope my breast doesn't resemble a water-filled balloon. It wasn't actually like that, but due to the perception, the Turkish people weren't fond of it. She preferred the prosthesis that was filled with gel silicone. At the moment, the serum-filled prosthesis isn't coming to Turkey. I wish it would. I believe it's still the healthiest choice. I would still advise this as my #1 option, but it's not available in Turkey now. I also use the prostheses filled with gel, the ones filled with gel silicone. Now, among these, I prefer micro-textured or smooth-surfaced implants. And in terms of type, doctor, which patient gets round and which one gets teardrop? Many years ago, around 10 years back, patients were very fond of teardrop prostheses. Currently, this wish, this enthusiasm, stemmed from the idea that a teardrop prosthesis would make the breast look like a water droplet. However, this was not accurate, of course. By explaining this to patients during this process, I believe my colleagues and I have solved this issue. If a patient's breast tissue is weak, indicating a small breast, as people commonly say, if it is a size 75 or an A cup, then it is necessary to choose a round-type prosthesis and a submuscular prosthesis. But imagine such a patient who has given birth and has some breast volume, however there is a slight sagging. In these situations, we usually opt for drop-shaped anatomical prostheses to rotate the nipple a bit higher. Essentially, these are the aspects we focus on. With a round prosthesis, your breasts do not look like a cut football. This is another false belief. After placing a round prosthesis, when the surgery's recovery time is finished, dear friends, your breasts will look like droplets of water even with a round prosthesis. We have discussed all of this. How long will the operation take? Roughly 45 to 50 minutes or about an hour. We typically discharge our patients the same day. They don't need to remain in the hospital. We will see them again in 3 to 4 days. We will take off the tight bandages we applied and then begin using the sports studio. You will also use the sports bra for a month. We'll meet again in your 2nd week. After seeing you, we say that you need to do these massages, you should do them this way, and you need to do them this often. We'll meet again in your 1st month. Have you managed? Is everything all right? Any issues? And we will keep advancing our follow-ups in this manner. We will continue. At the end of the month, you will be free from the sporty bra. You will switch to your regular underwear. You will be able to use underwear as you desire. The question of when I can start exercising is frequently asked. Thankfully, sports culture is growing in our country. 10 days after the surgery, 1 week to 10 days later, you will begin light exercises such as walking and jogging. A month post-surgery, you will be able to start weight training, but you will begin with light weights. Gradually, you will increase your pace and rhythm. Think of it as starting in the 1st month. Starting from the third month, you can push yourself to the extent of preparing for the Olympics.